Now, many of us took the ACT or the SAT, or we went to high school in which there has always been a right answer. And this morning when I went onto YouTube, it encouraged me to make a video called Choosing the Right Birth Plan. And it took me right back to the ACTs, which, by the way, not good at, not a good test taker over here. And it made me think that a lot of you think there is like one right birth plan. So today I want to talk about choosing the right birth plan and what that means for each of us. And I gotta say, as a nurse for 20 years at the bedside, I saw a lot of different birth plans. Now, did everyone write them down? No. Honestly, did a lot of people communicate them to me? Not so much. But I saw a lot of different things that people wanted in their upcoming birth. And I'm excited to give that information to you so that you can pick your right birth plan. Now, in case you didn't know, I have a birth plan, birth preferences sheet here. I entitle it birth preferences because I think that's a better option. You can download it. It comes with a free little series where I walk you through it. I'll put the link for how to get that down below. But today I kind of want to walk you through some of the high points of this birth preferences sheet and kind of why they're on there, and also making the right choice for yourself, because I am here to tell you it's not like the ACT or the SAT or that high school chemistry class where the answer was carbon. There really is not a right answer for everyone. And actually, if you followed me for a while, I firmly believe that there is not one right answer for anything pregnancy, parenting related that is right for every family. And so even though I'm a strong believer in kid counts and not co-sleeping, I still understand that choosing not to do those things may be the right answer for some people. And I think that is 100% true for birth. Okay, the first thing on my labor preferences sheet communicates to your provider ways that you've prepared for your upcoming birth. And I want you to be honest for this. If you have just watched some Instagrams and some TikToks, then put that there. If you follow the pregnancy nurse on YouTube, put that there. I always recommend that you take a full birth class. I have one that I recommend. I'm going to put the link for it down below, but it takes you from beginning to end so you don't miss anything. Plus, you get to get your partner involved because I am pretty sure that they are not following me on social media. Maybe they are, but my statistics show that men make up maybe 1% of the people watching my videos. Now, my birth preferences sheet starts off pretty easy. What do you want your environment like? Do you prefer a dim room or do you prefer it lit? Now, a lot of people online are like, you got to keep that room dim. But I am here to tell you that some patients really don't like it dark. They are afraid that they're going to wake up, they won't know where they are, and that makes them really nervous. So some people want all the lights on and some people want it dim. And both of those things are okay, but you kind of got to tell us. I was always like, it was like an optometrist's office when I would leave the room. I'd be like, this light on, this light off, because we had like 7 different lights in the room. This light on, this light off. And so because I always wanted to make them comfortable. Most people don't want the room like bright white with all the light, but there's a lot of happy medium and everyone prefers something different. And that is just the beginning to this birth plan. Understand that you are an individual and what you want for your upcoming birth is what is best for you. Now, as a caveat, a lot of people call this a birth plan, and you'll see on my form it says a birth plan because birth preferences is really hard to get in a little slot. However, this is what you would prefer in a perfect world, aka if you like the room dimly lit, but you also want an IV, you are 100% going to want that room bright while I'm putting the IV in, right? So it just depends on what's going on and what you're experiencing at this time. However, I think it's so important to think about what you like in general. And we're going to go through some of those steps with this birth plan right now. Okay, one that's on a lot of birth plans is your pain relief options, what you're planning to do. Now, most people just go straight up natural or straight up epidural. And of course, this isn't a perfect situation, which you may or may not have. Even if you want to have an epidural, doesn't mean you're for sure going to get the epidural. And even if you want to go natural, doesn't mean that you'll for sure go natural. In fact, I have a whole video on why people end up getting an epidural that you guys might be interested. I'll put the link for that video down below. Just knowing in advance which one you're going to prefer, I think that's awesome. That is really what the birth plan walkthrough is for you to think about what you would prefer in advance. On this birth plan, I have induction preferences, and this is one that I see so often. You know, everybody at 20 weeks is like, I don't want an induction. That sounds absolutely horrible. And then as we slowly start to creep up past 37 weeks, you start to think, getting this baby out might not be such a bad idea. Or you are the person who is still, no, I hate hospitals. I do not want an induction. The less medical this birth can be, the better. And you understanding what you want is awesome. Now, let's pretend like your blood pressure starts to creep up. and your provider is starting to say, you know, we might want to consider an induction here. When you've considered your birth plan, you can start that conversation with, you know, I understand what you're saying. I would prefer not to have an induction. That is what I would prefer, but I want to know what you're seeing so that I can make my best choice moving forward. Because again, birth preferences apply to what your situation is at that day. But I absolutely love that you know you would prefer not to have an induction, or maybe you're 39 weeks and your doctor's like, you know, we might want to consider an induction. And you say no more. I got my bag packed. Let's go into labor, because that's what you prefer. And neither one of those options is right. Again, not our chemistry tests from our junior year in high school where the answer was carbon. The answer is whatever feels best to you. As a reminder, in labor and delivery, there are very few cut and dry situations where we are like, this person needs this, right? Sometimes that happens. Sometimes we're having to run people back to the operating room, but it is really not very frequent. And so you really get to have a lot of input on how you manage that gray area. Here's another one that is on my birth preferences sheet, and it is baby going to the nursery. Now, a lot of you may not consider this. A lot of your hospitals may not have a nursery. When I started in labor and delivery, every hospital had a nursery, and you could go by and look at all the cute babies if you were in the hospital. That is not the case anymore. Probably good, because we don't need creepers checking up on the babies in the hospital. But if your hospital has a nursery, you might want to think in advance, is that something that I would like to use? Because again, there is no right answer for everyone. You might just want to think about the benefits, like getting some extra sleep, or just having a little bit of alone time before you go home. Or maybe you really prefer having the baby in the room. That just sounds better to you. And again, you're going to make it work when you have your baby. Maybe right after delivery, you thought you wanted to keep baby in the room all the time, but it turns out you are so tired and they offer to take baby for a couple of hours, and you think 2 hours of sleep is going to make me a better mom. By the way, what a great thing for you to think. So you send baby to the nursery, because there is no right answer for everyone. Now, on this birth plan, I have birth priorities. So I have a friend who in her birth class, her teacher told them to write down all the different things that they wanted for their birth. And she said, I want you to cross out all of them except for one or two. And those are the things you want to aim for your birth. So for hers, it was getting skin to skin after the baby was born. And that ultimately ended up happening, even though it was in the operating room. But her team knew that that was super important to her. So I have an area for birth priorities, things that you really want to have happen. Doesn't mean they're always going to have happen, but sometimes as a labor and delivery nurse, if you have strong preferences on a lot of different things, I'm never sure which one is really something that you're super wanting to do. So this could be really helpful in that situation. Okay, so what did I want you to learn from all of this? The answer is there is no right answer for everyone, and choosing the right birth plan is the right birth plan for you. And again, ultimately making those choices when you are actually in labor or your doctor talks to you about it in the office is what is going to be the really big win. I've got to know, have you filled out a birth plan? Tell us down in the comments if you found it helpful when you filled yours out. Now, applying your birth plan to your actual birth is a whole other video. I have it. I'm going to link it to it right up above, because you've got to learn how to make those choices in the moment. Thanks for joining us here on The Pregnancy Nurse, where we get you prepared, not scared, for your upcoming hospital birth.